Okay, if you're watching this video, then you are being considered for revision surgery. Before booking and starting your booking process, I would like you to know a couple of facts about revision surgery. Please know that revision surgery are complex surgery. Why? Because the more surgery that you had before, the more it leaves a scar tissue inside of your abdomen. So the more surgeries you have, sometimes patient can have like a band in, then the band caused problems, they took it out, sometimes they insert another one. So the more surgeries that you had, the more scar tissue you might develop. Because of this fact, revision surgery can be a lengthy operation. So revision surgery means converting one procedure into another. Having to do that, I have to undo everything that's been done before, together with undoing of all the scar tissue. This makes the procedure a bit lengthy. This compared to a primary surgery, let's give an example. If a patient is coming from a band to a bypass, comparing it to a primary bypass, at the end, both patients had a bypass, but the primary bypass would go faster, would go like an hour and a half, 2 hours. Compared to a revision surgery, it would take around 3 to 4 hours. Why? Because of the reason I've just mentioned. We have to undo all of the scarring, which can be so severe that everything is clumped together. Your liver, your stomach, your spleen, and we have to be very accurate up to the 1 millimeter degree. Because if you go one millimeter to the right or left, you can injure an important organ, and we have to be very careful and very precise. This in turn has statistically, based on research and science, statistically been found that revision surgery have more complication rate because of all of the above mentioned risk factors. So if you compare primary bariatric surgery to revision bariatric surgery, complication rates can double, unfortunately. However, we sort of bring out the big guns when it comes to revision surgery. We use special staplers, special stapler guns. Why? Because of those facts. We want the best and optimum conditions to minimize the chances of complications. Like I said, scar tissue is one fact. Thickening of the stomach is another fact from all the previous procedures that you had, even if it's just one surgery. Scar tissue cannot be detected by clinical examination or by x-rays. It has to be seen by the naked eye. So it's basically open and see. We have to go in and see. Fortunately, you might be one of those patients that have little scar tissue. So we're always fingers crossed that we go in. This means we go home early if your procedure goes faster because of less scar tissue. It's out of 12 years of experience, we've seen it all. We've seen patients with horrible scarring tissue and patients with just minimal scarring tissue as if they don't have. We have lots of videos. If you go on your YouTube and Instagram, you'll see lots of videos from inside the operation so you can understand what I mean by the scar tissue. So this is the first fact. The operation is longer, complications is a bit higher. The other fact is that revision surgery patients tend to lose weight a little bit slower compared to primary procedures. Why? We're not sure why, but we like to think, and theoretically we think your body is resisting the weight loss. And that's the main reason you're consulting us, because you might have lost a little bit weight with your primary procedure and you're coming for a revision surgery because you regained the weight. What happened is your body has tricked you and tried to lower your metabolism and bring you back to where you were. For that reason, the following surgery or the revision surgery, you tend to lose a lot slower. We have seen some of our patients have suboptimal results, and this has actually been concluded by extensive international research. Of the thousands of patients, we've seen them lose a little bit slower and sometimes suboptimal when compared to primary patients. So patients that never had any previous procedure tend to lose a little bit better. However, there are always exceptions, and we have patients that are doing marvelously. Some of them have been featured in the news on the Daily Mail, and they did amazing. And actually, one of those patients had a band done in the UK, converted to a sleeve, was suboptimal results, and then she came to us for a bypass, and she did amazingly well that she was featured in the news. I hope you understand all of those facts. Please, if you have any questions, don't hesitate to ask. We would love to help you in every single way.